what happened to Micah Parsons, and more importantly, what is a high ankle sprain? Hi, this is Dr. Mark Petrofoli, otherwise known as Dr. P, founder and CEO of Victory in Motion, home of knee repair, not knee replacement. Having said that, being a fellowship-trained sports medicine orthopedic surgeon for the last 26 years, I have seen thousands and thousands of ankle sprains over the years. I am going to show you on my own ankle what a high ankle sprain is. Okay, so I drew on my own ankle with red Sharpie. Yes, Mom always said don't draw on yourself, so don't do this at home. But this is the front part of my ankle right here. My toes are down here. This is the shin bone, the tibia. And so along the inner side over here, this is called the medial malleolus, this bone that sticks out right here on the inner side of your ankle. That's the medial malleolus. That is a bone that's part of the tibia. Now there's a ligament. Ligaments connect bone to bone. There's a ligament right here, the deltoid ligament, that connects these bones together to give stability to the inner side, the medial side of the ankle. Now, on the outer side of the ankle, over here, this is called the lateral malleolus right here. This bone that sticks out here. This is a separate bone. This is the fibula, okay? The fibula has 3 ligaments that go between it and other bones. The anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. These two, especially the anterior talofibular ligament, is the most common ligament when someone sprains their ankle, the calcaneofibular ligament next. These ligaments on the outer side and on the inner side are lower than the ligament right here, okay? So this ligament right here that connects the fibula, the smaller bone, to the tibia is the anterior distal tibia-fibula ligament. It's higher up than these other, so it's called a high ankle sprain. The problem with this ligament is it takes a lot longer to heal. So we'll talk a little bit more about that, but in general, ligaments take anywhere between 3 weeks to 3 months to heal. These on the outer side and on the inner side, they'll take 3 to 6 weeks, sometimes longer, especially if it's more than one sprain. But if it's the first sprain, usually players can sometimes even play the next week. But this high ankle sprain, that one takes a lot longer, and that's a harder one to recover from. Okay, so now that I've shown you what a high ankle sprain is, how is it treated? It's always going to be treated initially with rest, ice, compression, elevation, RICE, as they say. But how can we get that to heal faster, especially in someone like Micah Parsons or someone we need to get back quick? And I have a great example from several years ago, but I live in Skaneateles, New York, which is in the beautiful upstate New York Finger Lakes area. And we had our high school team had gotten to the state semifinal game. Our star wide receiver, Nick Wamp, sprained his ankle and had a high ankle sprain that semifinal game. So we had an MRI, x-rays, all those things, and that's what it showed. The championship game was 6 days later. So at the time, he's young. We knew he was going to heal faster, but 6 days is almost impossible to get a high ankle sprain to heal. Even play a lot of times. He couldn't even walk on it. It was completely swollen the next day. So we treated him with 6 days of VFit, total body fitness, physical therapy, and we also treated him with MLS laser therapy. Now, laser decreases inflammation, increases blood flow to the area, it decreases pain, and it also stimulates the mitochondria, which is the little powerhouse of your cell, if you remember that from high school biology, and that increases the cell's metabolic rate, producing more ATP, more energy. So that was able to get him to play in the championship game 6 days later, catch 2 touchdown passes, and win a state championship.
Tell us a little bit about your injury and then how Dr. P helped you.
Well, I play wide receiver for Skaneateles.
Okay.
And in our state championship semifinal game, I was handed the ball off by our quarterback and I was running towards the sidelines. And the opponent hit me in my ankle and I had a high ankle sprain. Okay. And Dr. Petropoli, he treated me on the field, and he saw me the next morning, and I realized I had a grade 2 high ankle sprain.
Okay.
And so he said that we're going to try to see if we can test the laser treatment on you. And we did that, and we also did physical therapy, and it got me back to playing the state championship game 6 days later.
Wow.
Which I felt no pain, and I was able to score 2 touchdowns to help.
Now I have a question. Let's
Yeah.
say this didn't exist. What would you have had to do? What's the I mean, it seems like this is much more of an efficient way to manage pain and help people.
Sure. I mean, it speeds along the healing process. So normally we would have started with physical therapy, but the type of sprain he had, to get him back in 6 days, he might have been able to play, but not at the level that he played. And he played amazing. And he caught 2 touchdown passes, and he didn't look like he was even injured. So
Nowadays, someone older who's going to take a little longer to heal, and I know Micah Parsons is young, and I know these NFL players are young, but they are a lot more high stakes, and they need to heal even faster. So we have been doing a lot of PRP, platelet-rich plasma, where we take the patient's blood, spin it down, get the platelets out. The platelets are those things, when you cut yourself, they form a scab, they stop the bleeding, so you don't bleed to death, but they also have growth factors, and they release those growth factors, and those growth factors stimulate new blood vessels and cells to come in the area, and they help things heal. So his body's going to start healing, or whoever sprained their ankle, their body's going to start healing, but this helps jumpstart it even more. It's like fertilizer or adding fuel to the fire. Now, the cells are what do the work. Platelets are not necessarily cells. They come from cells, so they don't actually do the work. They have growth factors. They're more like fertilizer. If you really, really, really want to jumpstart it, using bone marrow cells, or people sometimes take cells from adipose tissue or fat. There's stem cells. There's other cells that help the stem cells in that bone marrow. We concentrate that. We take those cells and all those other cells that help the stem cells and all the growth factors, and usually PRP as well, and inject that into the ligament. That is a really easy injection to do. It's right underneath the skin. We use ultrasound anyway to make sure we get it in the absolute right spot. And I have seen some amazing results treating ankle sprains with those type of treatments. So these are biologic treatments. Now, yes, you do have to harvest the bone marrow from the pelvis. It's about a 2 or 3 millimeter needle. So it's very small. It's unlikely going to cause any weakness to that bone. But if someone was worried about that, then there are places like the GARM Clinic, Global Alliance for Regenerative Medicine, which I'm affiliated with, down in Roatan, where actual stem cell treatments can be done. So they actually have stem cell technology where you don't have to harvest it from the patient, and it can be injected into the area where the problem is without having to harvest it from the patient. And that's really exciting technology. It's not available in the United States yet. I think it will be someday, but I know I have an NFL athlete who went down overseas to undergo these treatments in the off season. It helped him tremendously. I've seen very good results with it. Obviously, there are risks with anything, including surgery. Like sometimes a high ankle sprain might even need surgery. That's rare. One final thing on a high ankle sprain, just a caveat. If anybody remembers Marcus Allen, he was one of the greatest running backs at USC. Great with the Los Angeles Raiders at that time. And he suffered a high ankle sprain. And that is a harder injury to come back from. It's not just the, quote, typical ankle sprain. So Al Davis, the owner, thought he just had a regular ankle sprain, or just hears the word ankle sprain. So he basically thought that Marcus Allen was dogging it, and he wasn't. A high ankle sprain takes a lot longer to get better. So basically, my understanding is that was one of the things that led to him being traded to Kansas City. That was something I heard. I can't 100% confirm that, but I do know that he had a high ankle sprain, and it took a long time to heal, and these things can take a long time. So if you have Dallas as your defense, or I have a friend who actually has in his fantasy, they have defensive players. I've never played in a league like that, but they do, and he has Micah Parsons. So I said, basically, that is an injury that's going to miss some games. It's very unlikely to come back unless it's a very, very mild sprain, and hopefully that's what it is, a very mild grade 1 sprain where it's just barely stretched. But again, high ankle sprains tend to take longer than, quote, standard ankle sprains take to come back from. So my guess would be that he would miss some games, hopefully very few, and hopefully he gets some type of treatment other than just rest, ice, compression, elevation, and standard therapy. There are plenty of things to help speed that up, especially in an NFL player. So good luck, and if you have him on your fantasy team and you do have defensive players or that defense, you might want to switch it out for a little while.